You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Michelle Synakowski, how are you?
I'm very good. How are you today?
Thanks for coming over.
Thank you.
What
Thanks for having
is
me.
absolutely what is to work in healthcare as a non-physician person with physicians?
So working healthcare as a non-physician with physicians, sometimes it can be challenging, I'll be honest. But for the most part, I find if we all just work together as a team and we try to understand what each other's needs are, like what we need to do our part of the job and what you need to do your part of the job successfully, and ultimately always putting the patient at the center of everything, I think we're a lot more successful in that realm.
Yeah, we're we're not very compliant individuals in healthcare in general. So, um, how did you start working in healthcare? Can you bring us back a little bit on your journey?
I'm going to go back many years, actually. Right out of high school, went to nursing school. Went to a Catholic nursing school and got a diploma RN, which these days are taboo. Everybody thinks you need a bachelor's RN, right? But back in that day, we worked at the hospital. It was 4 days a week, 5 days a week with the nuns, and we got a great nursing education. And I came out of nursing school and started, right in the hospital. I was very fortunate. I went to a teaching hospital in upstate New York, and it really was an awesome experience because we had, the full round of med students, attending physicians, residents, first, second, third year residents, the attendings, the specialists, everything. And so I would round with them like every night and just get a wealth of knowledge and education because, obviously physicians look at things differently, but also very intricate within the lab work and the diagnostic studies and all of that stuff. So that was great. And I ended up pursuing leadership after that and going into the nursing home world. In the nursing home world, we don't have quite as much physician support. So it's more important, I think, in that environment for us to really know what we're looking at and be able to communicate well with the physician so we can kind of tell them what we're seeing. And that seems to work better. And I worked with medical directors for many, many years. I actually worked on a committee in New York State Department of Health to write the guidelines for medical directors for long-term care for New York State, which ended up becoming part of AMDA. I've adopted those guidelines.
Very interesting. So you have a lot of experience in leadership in healthcare, working with those centers. But so, what do you think it's the most important, I would say, skill that you need to have as a person to be able to get into this kind of positions?
I think you need to have a drive that doesn't stop, number one. No matter what the hurdle is, you need to be able to motivate yourself to keep going and then have the ability to motivate your team to keep going. And I think, that was important throughout my career, but I think really when COVID hit, we even saw it even more, because the staffing was horrible. Just all the regulations were changing every other day and the team was getting so frustrated, and I was in multi-facility management at that time running, multiple nursing homes, adult homes, whatever. And, the staff, you just needed to be able to motivate them to do their job. And you can't do that if you can't motivate yourself. And you definitely have to have a lot of emotional intelligence and really good team building skills.
How do you form those? Those are not taught in school.
No, they're not.
How do you
Sometimes they
train?
come,
How do you train yourself doing that?
I think some people have it and some don't, but I think it can be learned. Obviously I do teach that also. I teach leadership and emotional intelligence and soul-based leadership, conscious leadership, all of that. But I think it really comes when the most important step really is to put the ego aside. You have to be in it for the right reasons, and you have to be able to see people for who they are and understand their journey in life and what their objective is in order to really get into being able to see each member as a team, what motivates them, what drives them, what causes them to be successful, and what are their hurdles, what causes them to not be successful. And especially in the nursing home world, many of our CNAs and that come from very challenging home environments, and just being able to get to work sometimes is a challenge for them. So, if you're going to give them high level skills and all kinds of, training in verbiage that they don't understand, they don't get it, But I remember I used to walk by her every day and she'd be so grumpy and I'd say, smile. And she'd say, I don't feel like smiling. So every day I'd go by and I'd say, smile. And she was, I don't feel like smiling. I said, but I pay you to smile. So then one day I walked by and I didn't acknowledge her and she says, you didn't ask me to smile today. You didn't even notice I was already smiling. And, because I used to tell her, fake it till you make it, and she's like, I made it, right? But I think you have to see each one as an individual and really see yourself as on their level as a member of the team. Many years ago, someone asked me one time, what is your leadership style? I said, I lead from the middle. I said, well, how can you possibly lead from the middle when you have, titles and all this and that? It's because you have to see yourself as an intricate member of that team. You're driving it from the middle, you're setting the goals, but you're really, getting them to understand their job and drive themselves as much as you drive you.
Yeah, obviously the example that you portray towards others in your team and around you, it's essential for them to, emulate basically, because that's the whole leadership skill right there, to be able to show people how good can they be, right? And that starts with you. So are you still doing this? What's your present situation right now?
So currently I am running my own company. It's called ProSync Healthcare Compliance Services. And I do consulting. I do mentoring for nursing home administrators, directors of nursing, reimbursement consulting. I also do subject matter expert work. I do some expert witness testimony, those types of things, work on various committees for quality, and just I got out of the multi-facility management at the time of COVID. I had started my consulting business about 14 years ago, but I really went full-time into it right after COVID.
What made you choose that path? Because at some point, you're pretty full. I mean, you were pretty fulfilled with your career at that point, right? You're in a leadership position. You're a, coach also for other people and leader. So what made you kind of switch the gears towards your entrepreneurial side and start this business?
To be honest, it was the COVID vaccine.
Oh, how come?
Because I refused to get vaccinated and I couldn't work in healthcare in New York State if I was not vaccinated.
Oh, interesting. Okay, so you started.
So I had to
were
make a
forced
decision
out of the
to choose
system.
my health, and I said, I was, getting older as well,
Yeah,
and I said, that was going to be my path at some point. I was going to, go into that realm, and so it just kind of was the impetus to kind of put me over the edge. But I had a bad reaction to a flu vaccine back in the early '90s, and I really just did not want the COVID vaccine at all, and
yeah.
there was no way for me to do my job unless I got it. My team was very frustrated. They would say, Michelle, we're putting you in the car. We're driving you over to get the shot. I'm like, oh, I'm not getting the shot. Because my health was so important to me. And I'm so, I have such a vibrant life. And my passion is scuba diving, which takes, you have to really be, active and healthy and
Yeah,
strong. And I just didn't want to chance that at this point in my life.
very
It was
interesting.
a hard decision. Yeah.
Yeah, yeah, absolutely, absolutely. And it's hard when, you get pushed out of the system because of that. And um, I mean, you started this enterprise basically on your own because of the situation, and now you're doing this very successfully. So, what do you think there were some things that, when you look back, um, some setbacks or failures or something that didn't work out in your career that you said, you know what, I'll take this one for the team, but I have to move forward?
Um, Trying to think. I think sometimes staffing can really be a challenge, and I think sometimes, especially, in long-term care, a lot of people see the nursing home as like only the stupid nurses go there, which isn't true, really, because um, you really, like I said, we don't have a lot of physician support. You need to know what you're looking at. You need to know when you're going to call a doctor, that type of thing. But anyways, staffing can be very, very challenged. And the team gets very frustrated when the staffing is challenged. So many times, the directors of nursing, it will fall on them because if they don't have a nurse to run the floor, they have to go out and run the floor. So I think sometimes the biggest challenge that we would face would be the staffing situation because long-term care reimbursement just is not there. We were still getting reimbursed on our costs from 2007 in 2024, right? Or 2023. So, our Medicaid rate, at one time was like $178 a day. I said to somebody, I can go to a hotel and spend the night for $178 a day. But you know what? I'm not going to get nursing care. I'm not going to get a dietitian who's going to come check my diet. I'm not going to get a social worker who's going to sit and talk mood, get activities, get physical therapy, occupational therapy, speech therapy, and all of that we had to provide for this minimal amount of money. And so we really couldn't pay people really what they were worth. And that always bothered me because, our team is really what held it together. And the healthcare workforce really is where it's at, right? And I do think, the wages have come up, obviously, because there's been some mandates and things like that and whatnot, but the reimbursement isn't following. So it suffers somewhere, you have to cut somewhere. And I think that to me has always been the biggest challenge, because we would just keep cutting budgets and cutting budgets and cutting budgets and never trying to touch the nursing staff. You know what I mean? But you're cutting out all the other stuff and you're cutting out the benefits.
But this was not a challenge. This is a challenge every day because I don't think anything changed in reimbursements in that field. How do they manage this? How do you manage this?
Again, it goes back to the emotional intelligence piece because I've never taken a job or left a job simply because of the money. It's the environment within which you work and whether or not you feel that you have purpose and if you have a mission and if you are part of a cohesive team and you've all got each other's backs, and it's like you just get everybody so focused on the mission that they're just driving and we're going to do it and we're going to make it and we're going to do this and that, and I work.
Yeah, obviously this whole profession is based on a patient care. So you cannot be in this field if you don't care for the patients. That's given. But I'm thinking from the financial point of view, especially from your role as a leader and as a head of those nursing homes. How do you make things work? Because it's not enough. You can't make things happen with this low of reimbursement. What's the solution?
The sad truth is that many facilities are closing or
Yeah.
they're being bought, right? So multi-facility management is really where you get economies of scale, right? So, you have one CEO who's making, I won't quote wages, but let's just say, very significant wage, right? If you can take that CEO wage and put it over 5 or 10 nursing homes, it doesn't have the same impact that CEO has over one facility. Right. So the economies of scale, when you can have, like in my role at one time, VP of Health Services, okay, overseeing anything that had a health license, home care, assisted living, adult homes, nursing homes, whatever. You don't have to have quite the expertise level in the nursing homes. And so you can pay a little bit less, right, and still get quality people to do that job. So I think really that's where it is. And that's what we saw in New York and we're still seeing in New York, and I recently moved to Florida about a year and a half ago. But I do a lot of consulting still in New York. And what we saw is that many, many facilities were being bought out and by management companies that have 25, 30 nursing homes. And they have
do they get better contracts if they have this many facilities?
So you can get purchasing contracts that save you money, staffing contracts that save you money. Some of them also have like an arm that helps with billing and that type of thing. And so you will find that there's a lot more economies of scale once you start getting up into those numbers, multi-facilities. And unfortunately, your standalone not-for-profit nursing homes are just becoming ghost towns.
Are extinct.
Yeah.
They're drive to extinction. They're eaten up by this huge monsters of companies, right?
Yeah.
Is the care necessarily better?
I've seen it better and I've seen it worse. It really depends on the management company. There are some management companies that really, they want that 5-star rating. They want really good care so that obviously their reputations are good and they can attract staff and that. There are some that are in it just for the money, just as you would see anywhere else. And they will, cut and cut and cut and cut. I've seen them come into a facility and literally cut half the nursing staff down. And, especially not-for-profits tend to staff more people, tend to staff a little higher. So when I was in, running not-for-profits, I would tell them we need to think like a for-profit, right? We need to really look at, do we need this service? Do we need that service? What can we take away? Because ultimately, what's closest to the patient is our priority, and that's where that money needs to go. But you do have to make choices.
Yeah. What's your role presently in this machinery of, I would say, nursing home acquisitions and management? Do you advise them to what to do and how to do it? Do you have any opinion on what should they do?
What I have found that many of them hire someone similar to me with my skill set to consult within their many nursing homes. So, there's times that they get mandated, like if they have some quality issues, the state might mandate that they bring in an outside consultant. So I've done that. I've done state directed plans of correction and things like that. But most of the time, those big corporate nursing home entities are functioning very independently, and they don't want somebody like me. They just, I won't say they don't want somebody like me. They don't need somebody like me, and they don't wish to pay for that service when they already feel that they have that in-house.
I see.
But many of the, the not-for-profits are, I see a lot more than the for-profits. I do director of nursing mentoring and a lot of that with multi-facilities though, because they see a lot of turnover. For instance, I had one in Texas that they had turned over literally 3 directors of nursing in 4 months.
No.
Oh my God, what do I do? And so I told them, I would help them out, and I have this particular program. It's very definitive how we do it. It's an 80-hour program. It goes over 6 months. And 2 years later, that director of nursing is still there, and the one in the other facility recently just left. But they ended up with a lot better longevity because you put that money into them, and we teach them how to be leaders. See, I think one of the biggest challenges in healthcare is that we take somebody who's a good nurse or a good clinician in whatever manner, and we put them in charge because they're a good clinician. But that doesn't mean that they have good management skills, right? And they can make or break a company simply by being a poor manager.
Yeah, absolutely. I think that's a big distinction that people need to make. Being a good clinician doesn't mean that you're a good leader, and vice versa. But I think leadership is it's a learned behavior, and I think someone like you can help a lot of people learn that. I agree, maybe the entrepreneurs need to be born with some kind of gene in them to do this by themselves, but leaders in general need to be taught how to be a leader. And there's definitely, courses and books and, seminars about that. How do you personally conduct your business in this field?
I like to work very closely with the manager, the director, the administrator, whoever I'm working with.
Is
And I
it
always,
one-on-one training?
some of them are one-on-one. Sometimes we can do groups,
Mm-hmm.
3, 4 at a time. I do have some programs, that, they can click into, and, they can sit back and not have any interaction with me at all. I don't think that's a preferred way to do it. I really think that, teaching them and handholding them and being able to, as we go through a particular program, giving them examples of watch out for this pitfall, watch out for that pitfall, and make sure you do this, and make sure you do that. I think that's a lot easier to do when you're really looking them in the face and getting, do you understand me, right? When you're talking about a director of nursing level or a nursing home administrator level, that level is so integral to the success of that nursing home that you really do need some of that one-on-one time. Even when I did do multi-facilities, and I'll get 3 or 4 directors of nursing at a time, I will still schedule one-to-one time with them each week to just go over, so how's your week going? What are your challenges this week? And because there's things that are going to come up that aren't in class, right? And the other thing that I tell them is, if I'm working with a new director of nursing, I'm on call for you 24/7, because stuff happens in the middle of the night. And you can make really bad decisions if you don't know what you're doing in the middle of the night. So,
Yeah.
And obviously that comes, as a cost, but you have to give them that support. Otherwise they live in fear, and they can't really develop what they need to develop when they're in that fear mode.
I see. Um, being a woman in a leadership position and also being an entrepreneur, it's something that not many people can do. It's a tough job. How do you manage this every day? Like, what's your daily habit and routine to be able to cope with this, activities that you have by yourself?
Well, I do a lot of mindfulness training and things like that as well. I'm also a transformational life coach, and so I start out my day that same way. Okay, I am up early in the morning. I think it's important to be up early in the morning, so I'm usually up by 5:30, and I just
You need to do what you preach, right?
Yes, but you need time to set your mind straight, understand what you want to do for the day, and then I personally do some yoga. I make sure that I have a really good diet. I have a good breakfast and everything else, and I map out my plan for the day. I say to myself, I will have a successful day if I accomplish this. Okay, and that's my drive. Okay, that's got to happen, or the day doesn't happen. I know there's days that I work till 10 o'clock at night, but there's also days that I can quit at 2 in the afternoon and go take a walk on the beach. But you have to have really good systems in place and really good communication with the people you're working with, and be able to do that. But you have to have that drive, and you have to really make sure that your mind is in a good place, and every day is a new day. You cannot enter today with the stress that you came with from yesterday. This doesn't work.
Tell me a little bit about your life coach journey. When did you start that? What's your experience? And how do you think people should change their opinion about a life coach?
I went through the life coaching process. I felt, believe it or not, it was like it just kept popping up in front of me. And I was going through a really challenging point in my life. I got divorced after 33 years of marriage, and it was right after I had quit my job because of COVID, and I was just like, this sounds like something I'd be interested in. And so I started going through the process. I went through it with Mind Valley, which is an excellent program. And we would have coaching labs and work with each other. And what I found was the person that I was working with, I would work on them, they would work on me. And it truly is transformational. I mean, it just teaches you to look at life so differently. But one of the first things that we do when we're doing transformational life coaching is teaching people to dream and to dream big. Most of the time, you will be as successful as you can think you could be. I'll say that the right way.
Yeah, I know.
So
I
your
love
mind will stop you if you think, well, that's okay for that other person. They can reach those levels, but I don't think I could reach those levels. Then you won't, right? You have to think big. And so the first thing that we do is what we call the three most important questions. And we really spend time with people and we get them to dream and to give them a time limit and say, all right, write down everything that comes into your mind as far as if you could do anything in the world, what would you do? And if you had a mission and you could do any type of mission, what would you do? And really start to get people to dream big, and then start working to understand what their barriers are. And most of us have barriers from childhood. I saw a statistic one time that's like 90 or 95% of most families are dysfunctional. And it's true, or at least
or
perceived to be
underestimated.
dysfunctional, right? Because we think that we, had or didn't have whatever we should have had or didn't get in childhood, and I had a very challenging childhood, but it made me the strong person that I am. But we all carry baggage from that. And so, going back and being able to put some of those skeletons to rest and really, it really helps you then have confidence in your abilities and moving forward. And there's nothing that I can't do. That's my opinion, right? Absolutely nothing that I can't accomplish if I put my mind to.
It's indeed transformational for someone to have at least, I would say, a life coaching lesson or be in the presence of someone like you, because indeed, life accomplishments, I think, are all about how you look at them, at those accomplishments. And if you're not scared by how big you dream, your dreams are not big enough. So I think people need to understand that the big picture in life is all that matters. And like you said, you need someone who can open your mind to that. And I would definitely, advise everybody to maybe look into your work or, get your advice in this, or just go out there and look for a life coach, because it could be somebody that indeed that gives you a different perspective and a different view of how you need to look at life. People get very closed up in their eyesight by small things, by very small and inefficient and unimportant things in life. And that's not what matters. How do you want to?
Go ahead, I'm sorry.
Yeah, how do you want to develop your life coaching business from now on?
I really enjoy working with people who, they're getting older in years, maybe like myself, and just suddenly go, I want to do something different, but I don't know what I want to do. Or life just isn't fulfilling and I don't know what to do. I love working with people like that because then we start really opening up their minds or things like that, Or I've had people like stuck in a situation and they're just like, well, this is what it is. I can't do anything to change it. And, I've got one girl, we've been working together for a year and her life looks so different today from when we started, and she'll tell you, oh my God, if it wasn't for Michelle, I never would be where I am today. And, I didn't do anything special other than get her to overcome the barriers that were keeping her from her goals. And so what we do as a transformational life coach, we help people understand what their goals are. We don't set the goals for them, they set the goals. And then we help remove the barriers from them getting to where they want to be. And most of the time it's the mindset, and the most powerful question to ask somebody is that true? When they tell you, well, I can't possibly do that because of is that true? Right? Because most of the time it's what we were conditioned in those years when we were growing up, really those formative years that people will take with them forever.
Yeah, I always say, in everything in life, probably there's a saying, I can't. I can do that, or I can go there, or I can do this, or whatever it is. And I always think of myself of putting a different question. How can I do that? Or how can I go there? And it opens up your mindset to a different positive possibility rather than a negative one. I can't. How can I? And that opens up a whole different, perspectives in life. And like you said, you need someone who kind of opens up your perspective on this. And we certainly, each one of us, I don't think we don't know what we don't know.
Mhm.
So when you are exposed to someone like you who can give me or someone else a different perspective about my life from an outside point of view, that's very important. And people need that perspective. But yeah, I'm totally fascinated by this mindset realm that you can tap into, and most things in life are done not by your physical capacities or your environment where you are, but how your mindset is set to do what you want to do. So, Michelle, with your experience and wisdom and all you've done so far, if you would look back to your early years, to yourself, what kind of advice would you give to yourself?
Chill out. Seriously. Like I think about, years ago when I first started out, it was like I was just like this gung-ho leader, and I thought I had to really just, like, and I had some ego issues and stuff like that too. But if you just chill out and just take it one day at a time, and really build that team, and treat your people well, and really, get to know them, and help them accomplish their goals. They will help you accomplish your goals. You know? And as part of the whole life coaching, what we really do that helps people is break that big goal down into little goals. And every week be like, all right, what is one little thing you can do today and this week to help move you in that direction? We don't have to look at a whole big picture, but one little incremental step. And that's what I did with my people, like getting to know them on a one-to-one basis, and walking up and saying, hey, you had an appointment with your child yesterday. How did it go? That relationship building is so important to them.
Yeah, that's very important. I
We have to
agree
teach
with
our
that.
leaders really is, don't go in there with the idea that you're the boss and you're in charge and you're going to make it happen, because you can't. The people are going to make it happen. Your job is to figure out how to get them make it happen.
Yeah, very important. How can people reach out to you, know more about yourself, your work, get your advice?
They can go to my website, which is prosynchcs.com. So it's PROSYNK HCS.com, which is for ProSync Healthcare Compliance Services. Or they can email me at Synakowski, which is, I don't know if you're going to put my name up there, but MSYNAKOWSKI at ProSynchHCS.com. And I'd be happy to work with that. I do pro bono work as well. I think it's important to give back. So, if folks are just, if they're really challenged and they want help, but they really can't afford help, I do always make sure that I'm doing some pro bono work as well.
That's very nice. That's very nice of you. And I think you can help a lot of people just by doing that, because finally the whole purpose of this whole thing we're in is to give back to others, right? And if we help someone else, we can help ourselves. Thank you so much for being here.
Oh, thank you so much. Thank you again for having me. I really appreciate it.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Franku. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.